Did you know that some babies are born without a windpipe?
Wait, seriously? How is that even possible?
Yeah, it's a condition called tracheal atresia, where the trachea is completely absent. It's
Wow,
extremely rare and pretty fascinating from a medical standpoint.
that's incredible. So what causes something like that?
Well, it's thought to result from an issue during fetal development, like an obstructing lesion or a vascular problem. It's like
Right.
the blueprint for the trachea didn't get properly executed.
And are there other anomalies that come with it?
Absolutely. Up to 90% of cases have associated anomalies. Conditions like congenital high airway obstruction syndrome or COAS often accompany it.
Interesting. CHOAS? That's quite an acronym.
Ha, yeah, it's fitting. CHOAS can also result from tracheal atresia, tracheal stenosis, or even laryngeal atresia.
So how do doctors detect tracheal atresia before the baby is born?
Prenatal ultrasound is key. They might spot uniformly enlarged, echogenic lungs or signs like polyhydramnios.
Right.
It's a clue that something's not quite right with the airway.
Polyhydramnios is when there's too much amniotic fluid, correct?
Exactly. And sometimes they see dilated, fluid-filled bronchi or a decreased cardiothoracic ratio because the lungs are so enlarged.
Wow. That must make things really complicated after birth.
It does. Without immediate intervention, it's often
Yeah.
fatal. It's heartbreaking, but early detection allows for better planning and management.
Are there different types of tracheal atresia?
Yes, there's something called the Floyd classification with 3 types. Type Y has a proximal trachea missing, but a short distal segment.
Mhm.
Type 2 is when the entire trachea is absent, but there's a connection between the bronchi and the esophagus.
And type 3?
Type 3 is the most severe, complete absence of the trachea and carina, and the bronchi originate directly from the esophagus.
Incredible. That's mind-blowing. So how do they differentiate it from other conditions?
It can be tricky. Conditions like laryngeal atresia or severe congenital tracheal stenosis can appear similar on imaging.
I see. So imaging is really crucial in these cases.
Exactly. Without detailed ultrasound and sometimes MRI, we'd be in the dark.
Right.
Early and accurate diagnosis is essential.
It's amazing how much information we can get before a baby is even born.
It truly is. Advances in prenatal imaging have been a game changer.
Absolutely. But with such a rare condition, treatment options must be limited.
Unfortunately, yes. Surgical interventions are complex and the prognosis is often
Yeah.
poor. It's like trying to build a bridge where there's no foundation.
That makes sense. Is there any hope for better outcomes in the future?
Research is ongoing, but given the rarity, it's challenging.
Right.
Multidisciplinary teams are essential for management and support.
It's a tough situation for everyone involved.
Definitely. Awareness and early detection are the best tools we have right now.
Exactly. I'm glad we talked about this. It's important to shine a light on such rare conditions.
Agreed. The more we know, the better we can support those affected.
Indeed.